Hello, and thank you for participating in today's training in advance of the 2025 ACS CAN Cancer Action Day. My name is Michael DeVoli, and I am the Senior Government Relations Director of the American Cancer Society Cancer Action Network. This year, we have three primary legislative asks. The first is to reform New York's paid medical leave system. The second is to remove barriers to lung cancer screening. And the third is to expand access to patient navigation services. So let's explore issue number one. As you all know, battling cancer is hard. Continuing to work full or even part-time while undergoing cancer treatment is almost impossible. Nearly 3 out of 4 cancer patients and survivors say they missed work due to their illness, and 2 out of 3 missed more than a month of work. Making matters worse, more than a third of those who missed work did not receive any pay for the time missed. Studies show that cancer patients who have paid leave have higher rates of job retention and lower rates of financial burden. Yet not all cancer patients, survivors, and caregivers who work have access to paid leave, and without it, they risk losing employment or not getting the care they need. Temporary disability insurance is the part of New York's paid medical leave system that New Yorkers rely on when they need to take care of their own serious health needs. Unfortunately, the amount a patient can receive while on disability is only $170 per week, an amount that has not been increased since 1989. For comparison purposes, New Jersey, Massachusetts, Connecticut all provide over $1,000 a week. Making matters worse, there is no job protection for someone taking time off for treatment. A84S172 contains the reforms needed to make these programs work for all New Yorkers. It will remove the $170 a week cap on benefits for one serious health condition and increase that cap to 67% of the state's average weekly wage by 2029. That comes to around $1,150 a week. It would also provide patients coverage for intermittent leave, allowing them to take off a day or a week of time at a time and still receive benefits. Finally, the legislation would protect workers' jobs and health insurance during medical leave. The legislation passed the Senate 50-11 in March for the second year in a row. We want to thank the senators who voted yes and then ask all Assembly members to co-sponsor it and pass it right away. In your packet, you will find a list of the current co-sponsors. Our second issue is to remove barriers to lung cancer screening. Lung cancer is the #1 cancer killer, and like other cancers, if we catch it early, the chance of survival is significantly higher. Despite the effectiveness of lung cancer screening, uptake has been low, with only about 19.5% of high-risk New Yorkers getting screened in 2024. Only 31% of lung cancer cases are caught at an early stage. Treating lung cancer at stage 4 is 254% more expensive than treating lung cancer at stage 1. Federal law requires all insurance plans to cover lung cancer screening without cost sharing, removing a key barrier to these services, especially for individuals with limited incomes. This provision of the federal law has increased screening rates significantly. However, coverage for follow-up screening and diagnostic testing is not required. And research shows that required cost sharing, including copays, coinsurance, and deductibles, can be a significant barrier for individuals who need preventative services. This can be especially true among people with limited incomes, for whom these payments can represent a significant percentage of their income. Out-of-pocket costs for individuals have a significant impact on a person's chance of survival. The American Cancer Society believes that screening is a continuum of testing rather than a single recommended screening test. No other type of cancer allows for patient cost sharing. Only lung cancer. In recent years, New York State has passed laws eliminating cost sharing for breast and colorectal, and now it is time for lung cancer to be covered. ACS CAN supports S2000A1195, which ensures comprehensive insurance coverage and the elimination of cost sharing for lung cancer screening and follow-up testing for individuals by all health insurers in New York, including Medicaid. This legislation will increase the likelihood of cancers getting caught at an early stage, therefore improving patient outcomes and reducing healthcare costs. The bill passed the Senate 61-0 in March for the second year in a row and is now waiting for Assembly action. We are thanking our senators who voted for the bill and asking the Assembly members to co-sponsor the legislation and ask their conference to support it and pass it before adjourning in June. In your packet, you will find a current list of co-sponsors of the legislation. Our final issue is to expand access to patient navigation services. We all know how navigating the healthcare system can be confusing and complicated. Making decisions after receiving a complex medical diagnosis such as cancer is challenging for anyone, but particularly for populations that have been historically marginalized. So what is patient navigation? Patient navigation is the individualized assistance that helps a patient overcome healthcare system barriers from prevention and early detection of disease to accessing quality healthcare. Patient navigation offers tailored patient-centered care and the opportunity to prioritize unique patient needs. Patient navigators have been shown to help increase cancer screening rates, help patients better understand treatment options after a diagnosis, and help ensure patients receive the post-treatment care they need in survivorship. Patient navigation can help eliminate healthcare disparities and reduce costs across the cancer continuum by addressing the needs of people who have been historically marginalized and excluded, as well as those living in under-resourced communities from rural areas to dense urban centers. Patient navigation also has a proven return on investment and can help identify and diagnose diseases at earlier stages when less invasive and less costly treatment options are available to patients, often resulting in better outcomes and reduced overall costs. A large study showed that costs to Medicare declined significantly for navigated patients compared with non-navigated patients, with total costs reduced by $781 more per quarter per navigated patient for an estimated $19 million decline per year across the network compared to the non-navigated group of patients. This is just one of a number of studies mentioned in your Leave Behind materials. Patient navigators have been shown to increase patient retention and reduce provider administrative burdens. Patient navigation services are increasingly a critical component to cancer care and a must-have for all cancer patients. But don't just take my word for it. A recent survey of cancer survivors showed that patients could not agree more on the benefit of patient navigators and the need to expand access to them. While nearly all, 91%, agree it is important for cancer patients to have access to a patient navigator, only 55% say their primary oncology provider has a patient navigator available on staff. Yet to date, patient navigation services are still absent or limited in many cancer programs and hospital settings due to cost concerns and a lack of clinical reimbursement. Throughout the United States, a patchwork of coverage exists depending on where patients live and the type of insurance coverage they have. After a significant effort led by ACS CAN and ACS, Medicare began reimbursing for patient navigation in 2024. This historic change has opened the door to millions of people to benefit from patient navigation services, but it is only a start. Ensuring everyone who needs it will have access to patient navigation services will only be achieved by expanding coverage across both public and private insurers. S5565A6586 will require all state-regulated health plans in New York State, including Medicaid, to reimburse for patient navigation services provided to patients to improve access to care for individuals who are eligible for screening, follow-up, or treatment services related to serious illnesses like but not limited to cancer. Eligibility for patient navigation service coverage includes individuals with a serious condition that is expected to last at least 3 months and places the individual at high risk for one or more of the following: hospitalization, nursing home placement, a sudden worsening of pre-existing symptoms, physical or mental decline, or death. So as you can see, this includes diseases, but not limited to cancer. Under this legislation, only professional navigation services are eligible for reimbursement. Navigation services must be conducted by a trained, certified, and supervised navigator to receive reimbursement. What you see here are a list of some, but not all, of the qualified patient navigation services. Screening for non-clinical and social needs that do not require a licensed healthcare provider to complete, such as referrals and follow-up to connect individuals to services, including but not limited to transportation, employment, job training, food insecurity, childcare, housing, language, or health literacy support. Help with enrollment or maintaining enrollment in government programs or other assistance programs. Arranging for an accompaniment to an in-person or virtual healthcare visit or other prevention, screening and treatment, health education, health navigation, health advocacy, or other individual supports, including transition of care support. S5565, A6586 will improve care for individuals who are eligible for screening, follow-up, or treatment by expanding access to patient navigation services, by requiring all state-regulated health plans in New York State, including Medicaid, to reimburse for patient navigation services. New York State can improve patient outcomes and reduce overall healthcare spending. This is brand new legislation, so we are asking every lawmaker to please co-sponsor the legislation. Before I take questions, I would like to demonstrate for you a 2-minute pitch on our 3 priorities that you may use in any meeting. Our first issue is to reform New York's paid medical leave system. This bill is in the Assembly now and has already passed the Senate. No one battling cancer should have to choose between feeding their families and taking time off for treatment. New York's paid medical leave system is not meeting the needs of cancer patients. A84 by Assemblymember Szilagyi will provide cancer patients and others a living wage and protect them from losing their job and health insurance while undergoing treatment. Will you ask your assembly leader to support A84 and co-sponsor the bill today? Our second issue is to remove barriers to lung cancer screening. This also is just in the Assembly and has already passed the Senate. Lung cancer is the #1 cancer killer. Out-of-pocket costs for follow-up lung cancer screening and diagnostic tests are preventing people from getting screened and contributing to the high rate of lung cancer deaths. A1195, sponsored by Assemblymember Peoples-Stokes, will eliminate patient cost sharing for lung cancer screening. Will you co-sponsor A1195 and ask your Assembly conference leader to pass it right away? Our final issue is to expand access to patient navigation services. This bill is newly introduced in both the Senate and Assembly. Patient navigation services improve patient outcomes and reduce overall healthcare spending. A lack of patient reimbursement for navigation services is preventing many patients from accessing them. S5565 by Senator Bailey and A6586 by Assemblymember Weprin will require all state-regulated health plans, including Medicaid, to reimburse for patient navigation services. Will you co-sponsor this legislation today? This concludes an overview of the legislative priorities for the ACS CAN 2025 Cancer Action Day. Thank you very much.